are we today? And why are we here? If you look at all the countries that would have advanced in a marked manner, you would realize that in their budgets, they spend a lot on research and development. If you look at companies that are celebrated across the world, they're celebrated because they invested in research and development. If you look at us, this category of expenditure carries the lowest weight, both in the private sector and the public sector, and we have to fix it. We have to fix it. Otherwise, we cannot be innovative. We cannot have our local talent coming through and the potential of making mind-blowing changes on the global scale. We have to fix it at the private level and at the public level. And that is the conversation we have to have. This is a beautiful building. We have many beautiful buildings in our country. How do we treat these buildings? We treat these buildings as a form of blocks and cement. There's nothing sentimental. There is no attachment. And that leads to an environment of no care. Compare the way we treat a public building with the way we treat our home. How do we fix this? The cause for a cultural shift. We have to fix ourselves as a people. We have to fix the way we think, the way we act, and the way we utilize the resources of our country. Issues of littering and all these things, we can invest every single day. We can spend more. But if we don't fix the mind, then we cannot fix the problem. We have to individually and collectively fix ourselves as a people. And we are fixable. Just take, for example, and many people give this example, our immediate change of attitude when we go to an environment that requires a higher level of behavior. Some things are not convenient, but it's the inconvenient truths that help us to change our society. It's for that reason I decided to remove myself from my prepared speech and to address some of these key issues that we may be afraid to address sometimes. And when I say we, I am included in this. The government is included in this. Every single leader in this country, they are included in this. All of Guyana is included in this. I agree with Dr. Paloma. But I'll give you an example. Someone told me a few days ago, we have the greatest opportunity to be the major supplier of livestock in the Caribbean and beyond. Why the government doesn't invest in 5 state-of-the-art international abattoirs? And I said, okay. When you examine the numbers, however, with one order from the Middle East, from one country, it will take all the livestock we have for the entire year in one order. So what do we fix first? We can't go to the top of the value chain if we don't fix the bottom. And when we talk about healthcare and you look at the value chain, we have to fix primary healthcare. We have to fix primary healthcare. And to fix that, we have to invest in community healthcare. And you will see, for a matter of fact, in the next budget, we are going to create a new program for research and development at a primary healthcare level. I'm happy Dr. Bobin is here. Because when you review the CV of the human potential we have in this country, it's mind-blowing. And if you look at the utilization rate, I would say that 75% of those highly skilled people are underutilized. We have to put that skill to work. We have to put those skills to work, and we have a primary healthcare problem, and we are going to fix it. We're going to fix it together with the practitioners. We're going to fix it with the university. We're going to fix it with the ministry. And then we're going to build up the health chain. It is for this reason that years ago we conceptualized the need for more doctors. And we launched the 1,000 scholarships in Cuba. A program we will continue. But we will build the local capacity to take up those opportunities too. And Dr. Paloma, you're right. In building the capacity of the university, we have to build the capacity for the rotation. That is why, and I'm happy the Indian High Commissioner is here. Through a $17 million investment program, very soon we'll commence the modernization and expansion of the Saudi, West Dem, and Bartica hospitals. I want to remind our budding doctors that you are not advancing a career only to be doctors in Georgetown. There's always been a great difficulty for us. You're doctors for humanity. Wherever humanity exists, your skills and your oath will take you. So sometimes we have to gear our minds for that. And that is why we want to take the load off of the Georgetown Hospital too. Many times the Georgetown Hospital comes in for criticism. And I want to recognize the hard-working medical professionals and the nurses, the attendants, the cleaners, everyone in Georgetown hospitals and the healthcare system across our country. But they're overwhelmed because the system is not working. Let's be frank. Let's be like the Minister Frank. The system is not working. And I know Dr. Anthony and his team have started to review the system. They just had a comprehensive review of New Amsterdam. So we have to fix the system at the regional level, like the Vice Chancellor said. But importantly, in addressing primary health care, we have to fix the systems at the district level. That is why we have set aside resources for the upgrade of many district hospitals, including Lethem, Paramakotai, Diamond, Lenora, Linden as a regional hospital, Region 8, we are going to the community level. And when we go to the community level and we train our doctors, they are not to be manned, they will be manned by doctors, they will have doctors there to take care of the needs of the people. So I want to assure Dr. Paloma that we are with her. But as I said, it requires a shift in thinking. And I want to address an issue here as it relates to our medical personnel, doctors and nurses. I'll be the first to admit to you that you deserve more, you deserve better. But I'll also be the first to tell you that we are a growing economy. We just had an emergency budget. And it is your president's commitment and your government commitment that you will get more and you will get better. Just give us the time. The economy is going to grow. And we recognize the fact that we have to provide more. For every category of our workforce, we have to give more to the farmers also. But we know the type of work you're doing, even in this pandemic, when such fear grips our society. So I agree. We have to do more and we will do more. But at the same time, sometimes we have to understand the circumstances under which we are providing our service. This is a critical time for healthcare systems all across the world. This is not a period for us to take lightly. This is when your oath comes to the ultimate test. When you work in a pandemic, you're not putting a salary on the line, you're putting your life on the line. This is when the oath comes into effect. This is what distinguishes the great profession of medical doctors. Periods like these. And we have to act responsibly in periods like these. It is because of the level of responsibility and commitment of Dr. Yesu Persaud that he is so successful, and in sharing that success, he can present this to the people of our country. Only last night, I had to endure a few hours of lecture from my wife, who visited the hospital and walked through the pediatric section. And at the end of every sentence, when are we going to build a specialty hospital for the children? When they will have their own hospital? I woke up this morning and the lecture continued. So I decided that I would invite Dr. Frank for breakfast and he would endure that lecture. But you see, it is only when you understand the problem, when you see the problem, you understand the need. Do we have to build it? Yes, we have to build it. Will we get the resources? Yes, we will get the resources. We will get the resources. We're speaking with the Emir of Qatar now to bring in 3 field hospitals, to bring in additional medical equipment. Every single day we are working at a bilateral level to ensure we are first on the list for vaccines when it comes. This pandemic has taught us a very basic lesson globally. That is, regardless of how powerful you are or how little you are, we are all subject to the same threat as human beings. And Dr. Yesu Persaud ended his presentation with the issue of us uniting. A few days ago, I said it was the responsibility of leaders to ensure this country is united. Today, I see the media, presence of the media is here. When are we going to change? When are we going to do our part? When are we going to stop encouraging the hate that exists on social media? When are we going to utilize our gift as professionals, as educators, to come out when wrong is being done and say it is a wrong, stop it, return to the right path? It is very easy. It is very, very easy for everyone to say we must unite. When we are united, we'll be at our best. But we all, each one of us, we all have a role to play in that change. It is how seriously we take the role. Do we have it in us? We have shown the world many times as Guyanese we have it in us. Many, many times we have shown the world that we have it in us to present a part of multiculturalism. We can lead the world in multiculturalism. We have it all here. We can set the example. We can show them how to coexist. That is our gift, being different people. And how is all of that linked to this facility? It is linked to the facility. Because if we can't, as a people, come together in a singular way and see the opportunities and potential that exist in our society and benefit from those opportunities and potential, then these buildings will not fulfill their true meaning. As Dr. Persaud said, he was denied an education because of his religion. So we are going to invest in strengthening and creating the enabling environment, have the right policy mix, and to create a new wave of thinking. Public-private partnership. We have started by giving corporate tax break on private education, private health care, private health services. That is the beginning. We now have to integrate private health care with national health care. That is the task ahead. Creating a level playing field where access to health care does not depend on economic barriers. It will come as the country gets better in terms of its economic position. When we talk about technology and modernization, we are discussing right now with the Indian High Commissioner the electronic medical records system. That is from birth to death. Every citizen of the country will have an electronic management of their medical system and medical record. So whether you move from Georgetown to Westdam, you don't have to move with thick layers of file. Your health record is there in a management system, can be accessed at the private level and at the public level. That's a major shift in modernizing the delivery of health care. All of this, of course, cannot be accomplished if we don't have a human resource component. That is why we are going to grant 20,000 scholarships across our country in every single field. Next year, we are hoping to commence the first 5,000 scholarships. We are already in discussion with more than 10 universities across the world. One spin-off of COVID is that it accelerated the development plans of many universities in providing distance education. So plans that were 10 years down the road came up as priority now. The Vice Chancellor of the University, you have a challenge too, to get on board quickly. It is envisaged that by the year 2030, less than 20% of the student population will be in buildings. Finally, we are working with the Indian government in creating the first regional center of excellence at the University of Guyana with the IT center there, where we are going to have a regional center of excellence for all of CARICOM, training of all of CARICOM specialized IT needs. And that is where we should aim to be in our medical services. especially the postgrad services. We have the talent here. We should work on ensuring we reach the highest standards so that we can create, within the 5 years, a regional center of excellence. I thank you. I thank Dr. Yesu Persaud. God bless you. Continue to stay healthy and strong. And we look forward to many, many more years of your care and love for country. God bless you. Thank you very much.